If you can please
Okay.
unmute. Yeah, I got it, the pop-up. So I'm starting. Good evening, participants. Thank you for joining Shield Connect today. And I also thanks for your patience for waiting for a few minutes. So today we have Dr. Jaya Lakshmi from Salem, and ma'am is going to take a webinar on the topic probiotics in urogenital infections. So before we start the session, let me give a little introduction of our speaker as well as for the page Shield Connect. So let me share my screen. So first of all, this is our page shieldconnect.in. Where you can see there are various sections available. So the first section is the blog section, where you can find all the new blogs we have received from the speakers as well as experts who are connected with Shield Connect. Then we have webinar section where you can find upcoming webinars calendar. So you can just click on see more and you can join our session. And here in the comment section, participants, you can post your feedbacks and queries. So at the end of this session, we can have a Q&A session with our uh, speaker for the day. Then we have the past webinar section where you will find all the webinars that we have conducted in past. So you can also go through that page. Then we have four awareness pages now. Like recently we have updated with menopause awareness, and PCOS awareness page contains all the videos related to PCOS in different languages: Hindi, Malayalam, English, Tamil. So you can go through this page. This is the patient awareness kind of page, and then this is the menopause awareness page where you will find all the videos and blogs related to menopause. Then similarly, we have same kind of approach for COVID-19 awareness page. So you can go through this awareness pages. Then we have our leader section where you can find all the speakers and doctors who are connected with our page Shield Connect. So you can also go through their profile. And this is our special page where you can find all the special day related pages. So for example, if you will click on hypertension day, you will find all the videos related to hypertension. So this is our page Shield Connect. And now let me give quick introduction for our speaker for the day. I welcome Dr. Jaya Lakshmi. Ma'am is MBBS, DGO, DNB in OG, and ma'am is consultant obstetrician and gynecologist in Sri Balaji Hospital in Salem. So ma'am, we welcome you on our platform, and I will hand over the session to you, ma'am. Thank you so much.
Thank you. Thank you for the introduction. Let me share the screen.
Yes, ma'am. Yes, it is visible now.
Okay, thank you. Good evening, everyone. I'll be talking about probiotics in urogenital infections. And the normal vaginal flora is constituted mainly by the lactobacillus, which is about 95%. And usually there is less than 10^7 organisms. And the ratio of anaerobes to aerobes is 2:1 to 5:1. And the Gardnerella vaginalis is present in 5 to 37% of women. Mobilincus is in about 0 to 5% of women. There are some H2O2 producing bacteria, which is also present as a potent natural microbicide. And these normal vaginal flora maintain the vaginal pH and provide protection against the infectious bacteria. The composition of the vaginal microbiota is this lactobacillus, which has so many groups, as you can see here. And the changes in the vaginal microbiota keep pace with the hormones, and it varies with the prepubescent young girl and adult women during periods, pregnancy, and during menopause. And in adult women, mostly it is dominated by lactobacilli, and also in pregnancy. And in the prepubescent, during periods, and menopausal women, it is mostly with a polymicrobial flora. And the factors that influence the change in the vaginal flora, the vaginal dysbiosis, which it can cause, is normally the commensal bacterial communities under certain circumstances become pathogenic, like those that Gardnerella vaginalis, E. coli, Candida, which are present normally, can also become pathogenic under some circumstances when there is a shift in the equilibrium which favors their competitiveness. The dynamic equilibrium of the vaginal microbiome usually is altered by the environmental factors and certain external interferences like antibiotics, vaginal hygiene, sexual intercourse, hormone therapy. And these alterations can result in microbial imbalances or dysbiosis in the urogenital tract. The vaginal infections that are commonly found is due to the shift in the vaginal flora from the dominant lactobacilli to a polymicrobial flora, and usually the cultured microorganisms or Gardnerella vaginalis, mobilincus, Mycoplasma hominis, Prevotella, and Streptococcus species. This pathogenesis is usually due to change in the vaginal pH, and the lactobacilli is more preferably found in the acidic pH. And when there is increasing pH, there is more tendency to shift in the vaginal flora, and there is more chance of infection and increasing symptoms. The bacterial vaginosis, which is the common vaginal dysbiosis among the women of reproductive age, it is most common cause for the abnormal vaginal discharge, usually women present. And it is characterized by vaginal malodor and increased vaginal pH and vaginal itching. And in most cases of bacterial vaginosis, the predominant microbe is Gardnerella vaginalis. And the next one is the vulvovaginal candidiasis, which is the second most common after bacterial vaginosis. And it is caused by abundant growth of yeast cells and belonging to the Candida species in the vaginal mucosa. And it affects 3 out of 4 women in their lifetime, and more than 40% of affected women have had 2 or more vulvovaginal candidiasis episodes. And candidal infection is more common in pregnant women. And the infective organism is a fungus which reproduces by budding, and 80 to 90% it is Candida albicans. The other organisms which can be found are Candida glabrata, Candida tropicalis, and cruzi, and parapsilosis. The difference between the bacterial vaginosis and vulvovaginal candidiasis is that bacterial vaginosis is more common with pH more than 4.5, whereas candidiasis is favorably in acidic pH. The bacterial vaginosis presents with thin, milky white, grayish discharge, while the candidal discharge is white, curdy, and cottage cheese. And the amine odor whiff test is positive in bacterial vaginosis, which presents with fishy odor, which is absent in candidiasis. On microscopy, normally we could see the lactobacilli and the epithelial cells, whereas in bacterial vaginosis, it's the clue cells, the adherent cocci, and there will be no WBC, scarce, or no lactobacilli. With regard to candidiasis, we could see the budding yeast hyphae and pseudohyphae. There is another entity which is aerobic vaginitis, defined by disruption in the lactobacillus dominans, but it is accompanied by more extreme inflammatory changes when compared with bacterial vaginosis. And this can be caused by aerobic bacteria, including the group B Streptococcus, Enterococcus faecalis, E. coli, and Staph aureus. These present with yellow-green discharge, and the vagina is red by inflammation. pH is 5.5 to 6.5. And there are many toxic leukocytes and parabasal cells. It is observed in 8 to 11% of pregnant women and in 5 to 24% of women reporting vaginal complaints. And the characteristics of this is that, as already said, the pH is more than 4.5, usually more than 6, and whereas the bacterial vaginosis is more than 4.5. It presents with yellowish discharge with epithelial inflammation, and there are parabasal cells shed, and it is negative for whiff test. The lactobacilli species is displaced. The immunological inflammatory cytokine reaction will be high in aerobic vaginitis, and it is usually treated with clindamycin topical, fluoroquinolones, whereas the bacterial vaginosis will need metronidazole and clindamycin. With regard to the urinary tract infection, all around the world, it is estimated that several 100 million women suffer from UTI annually, and it is another casualty of an unhealthy urogenital microbiota. There are multiple risk factors which can predispose to UTI, including sexual intercourse with multiple partners and exposure to spermicidal agents as well. These spermicides leads to loss of lactobacilli, and there is increase in pH, which can stimulate the growth of gram-negative organisms and subsequent UTI, of which E. coli is an organism responsible for the largest proportion of symptomatic and asymptomatic UTI in women. How does this vaginal dysbiosis contribute to UTI? The depletion of lactobacilli or imbalance between these lactobacillus and the uropathogens has been documented in patients with urinary tract infections. Vagina is a key anatomical site in the pathogenesis of UTI, serving as a potential reservoir for the infecting bacteria. The initial step in the pathogenesis is colonization of the vagina and periurethra with infecting uropathogens, followed by ascension of these uropathogens through the urethra to the bladder and sometimes to the kidney and cause infection. Multiple culture-based studies showed that women with recurrent UTI often have had increased rate of colonization with E. coli and depletion of the normally predominant hydrogen peroxide producing lactobacilli. Usually, UTI is treated with the antibiotics, and a short course of antibiotics is the treatment of choice for acute symptomatic UTI. And sometimes for recurrent UTI, postcoital or monthly courses of antibiotics have been given. However, rising rates of antibiotic resistance coupled with increasing UTI recurrence call for the development of new and effective treatment strategies to combat their prevalence. The vaginal dysbiosis and preterm birth, the pathogenesis, what has occurred is the ascending intrauterine infection earlier in gestation accounts for about 50% of spontaneous preterm births. The abnormal vaginal microbiota leading to ascending intrauterine infection and bacterial colonization of the decidua fetal membranes and microbial invasion of the amniotic cavity. There will be release of pro-inflammatory cytokines and chemokines. The prostaglandins are released and matrix metalloproteinases and the CRH, resulting in uterine contraction, cervical remodeling, and membrane activation, resulting in the onset of labor. The disadvantages of the current treatment options with antimicrobial therapy, there are up to 10 to 15% of patients fail to respond to the initial antimicrobial therapy, and the recurrence rates over time among responders remain significant, reaching up to 80%, which will necessitate repeated administration of antibiotic. And such repeated antibiotic exposure increases the risk of emergence of resistant strains, alteration of microbiota, and possible persistence of pathogens. What is probiotics? The WHO defines it as alive microorganisms which, when administered in adequate amounts, confer a health benefit on the host. So what mechanism of action it does have in the women is that it restores a healthy pH to less than 4.5. There is competitive inhibition over the pathogenic bacteria. It modulates cytokines to decrease the inflammation and also produces hydrogen peroxide, which kills pathogens and lowers the pH, and bacteriocin production, which kills the pathogens, and also produces biosurfactants, which break down pathogen biofilms. The role of probiotic in preterm birth, it has been reported that it has reduced the risk of preterm labor by 18% in a study. And another study has also found that the consumption of probiotic product during early pregnancy reduced the risk of preterm delivery by 21%. And as we know, bacterial vaginosis is the most common infection associated with preterm birth, and this probiotic will definitely have a better efficacy and prevention of preterm birth in those cases. The probiotics in the treatment of IVF, it represents an effective treatment for dysbiotic conditions affecting the fertility. Oral supplementation of probiotic lactobacilli restores the normal balance of the urogenital microbiota, which reduces the colonization of pathogenic bacteria and prevents their ascension. Probiotics that contain live lactobacilli capable of recolonizing the vagina may offer an elegant and safe choice of treatment. The lactobacillus species in particular are helpful in the treatment of infertility since they are the predominant microorganisms of a healthy human vaginal microbiome and have been shown to prevent pathogenic infections associated with fertility and preterm birth. The safety of these probiotics have been proven, and it is considered mostly safe. And the lactobacillus species utility is related to their GRA status. And an article published in 2011 has found that these probiotics do not appear to pose any safety concern for pregnant and lactating women. So it can be safely given in them. The systemic absorption is rare when probiotics are used by healthy individuals, and the current literature does not indicate an increase in adverse pregnancy outcome. The clinical evidence also says that probiotic interventions were effective for treatment and prevention of bacterial vaginosis and prevention of recurrences of candidiasis and UTI. There is another double-blind randomized placebo-controlled study which shows that oral probiotics could be an alternative side effect-free treatment for one of the most common indications in the gynecology. And the choice of probiotics will have to see if it contains the common lactobacillus. The content of the capsule is very important when we choose to prescribe. It should be specific for the vaginal microflora. And to summarize, the urogenital infections such as bacterial vaginosis, vulvovaginal candidiasis, and urinary tract infection affect billions of women each year. For patients suffering from bacterial vaginosis, they have an increased risk of preterm labor and acquisition of sexually transmitted disease. The vaginal dysbiosis is also associated with infertility, adverse reproductive outcome, and poor clinical outcomes in women undergoing in vitro fertilization. Although effective antimicrobial treatments are readily available, concerns mount about the antibiotic cost and the overuse of antibiotic or overexposure, sensitivity, and sequelae. And the most important thing is the antibiotic resistance. The rationale for urogenital probiotics comes from the belief that replenishing the normal microbes will counter pathogens and lead to return to the lactobacilli dominated state found in healthy women. The probiotic lactobacilli are commonly used choices for treating and preventing the urogynec infections, and due to their ability to produce antimicrobial compounds, that is including bacteriocins, lactic or acetic acid, and hydrogen peroxide, it prevents adherence of pathogens to vaginal epithelium, and it helps restore the altered flora. So oral supplementation of probiotic capsules are particularly alluring because of their ease of use and high satisfaction versus the use of cream and gels. Thank you.
Thank you so much, ma'am, for giving information regarding urogenital tract infection, how probiotics are helpful in treating this infection. So let me check if we have any queries in the comment section. And 1 minute.
Yeah. Okay.
So, ma'am, I have one question that how the genome specific species is required for any kind of probiotics to be given to the patient for treating this infection.
Pardon, the lactobacilli with the
Yes.
specific to the species. Those group with crispatus,
Hmm.
lactobacilli, ganseri. Can I show that slide?
Yes.
Yeah. The composition of the normal vaginal microbiota is with Lactobacillus crispatus, ganseri, Lactobacillus inus, and genense. So those capsules with the predominance of these will be more specific for the vaginal microbiota. There are some probiotics which can be given for the intestinal infections. So we have to choose among them which is the best for the vaginal microbiota.
And ma'am, any experience from your end that after giving the probiotics to the patient, they had a good fertility success rate?
Those, especially with recurrent vaginal infections, they have found it, they have been benefited with this use of probiotics. Because it will restore the normal microflora and the pH. So when there is return to normal vaginal environment, and there is increased chance that they have more chance for becoming pregnant.
And any kind of a recommendation on diet for urogenital infection patient who are coming, and they might be asking that what kind of
Normally,
diet?
these probiotics are usually found in the curd, yogurts. So that can be taken.
And one more question is that if a patient asks for that, they can do any heavy kind of exercise during this kind of issues. Normal female with this infection.
Any button exercise?
Yes, heavy exercise or mild exercise.
No, exercising actually improves the health. They are found to be benefited with exercising, and when they are used to, they can continue with their exercise. When they have to start with, they can go for mild exercise to start with aerobic, and then they can go on to have their heavy exercises. Not in particular with if there is any vaginal infection, they have to cut down on their physical activity. But on recurrent infection, they may have they may feel down when they may feel low, or they may feel weak actually.
And one more question. If the patient, the pregnant patient, comes with the antibiotic resistant issue, so does probiotics overcome this infection?
Yes,
In your
probiotic we'll have to give for a month. Sometimes patients may need one capsule once or twice daily for a month. In those patients, it has been found helpful.
Thank you so much for giving all the answers to the questions, ma'am. And we are glad to have you on our platform. And I also thanks Delicate to join for today's webinar. And ma'am, we would like to also have more sessions with you in coming future. Thank you so much, ma'am. So we can wind up.
Thank you. Thank you so much.
Bye, ma'am.